Good morning. Today we'll be talking about a very painful subject, which is the subject of pregnancy loss and neonatal loss, because the World International Day for that awareness was on the 15th of October. Thank you, Dr. Omololu, Dr. Dosekun, and Dr. Oyeniyi for coming on the program. It's a pleasure to have you with us today.
Thank you. Good morning.
Good morning. So, Dr. Omololu, we can dive straight in. Pregnancy is one of the happiest times of a woman's life, and a very happy time usually for the family and everyone. The expectation of a new birth is something that is always really such a joy. And yet here we are today talking about pregnancy loss. So can you tell us, what is pregnancy loss and why does it occur?
The name speaks for itself. Pregnancy loss is when, a baby stops breathing within the womb while the woman is still pregnant. And sometimes it may also have to do with the expulsion of the baby, the placenta, and all the products of conception while the woman is still pregnant. Pregnancy loss is actually quite more common than we know or than we think, because it's estimated that up to 50% of all pregnancies will miscarry. That's half of all pregnancies. But the good news about that is that most of the time with that one, the woman may not know she's pregnant. It may happen before she even misses her period, because pregnancy actually occurs kind of midway into the period. So sometimes, most of the time, pregnancy loss would have happened before she knows she's pregnant, and she may not even have been aware that she was pregnant. But by the time a woman knows she's pregnant, pregnancy loss is just about 10 to 20% of all pregnancies. And most of these pregnancy losses will occur within the first 3 months of pregnancy. Usually after the first 3 months of pregnancy, then it's less likely to have a pregnancy loss. Only 20% of all pregnancy losses will occur at that stage. There are many reasons why a pregnancy loss could occur. And these are various factors having to do with the mother, factors having to do with the baby, and factors having to do with the placental unit itself. So starting from the mother, if the mother has some medical conditions, those could easily lead to a miscarriage. For instance, if the mother is diabetic, if she has hypertensive diseases of pregnancy, if she has resource incompatibility, resource isoimmunization, she has any infections, those are things. If she has a uterine abnormality, her uterus is not a normal uterus, if she's exposed to x-rays and stuff like that, another external thing. If she's on substance abuse, if she smokes, if she takes drugs, what we call hard drugs, or even some medical drugs which are not safe in pregnancy. These are some things that could lead to maternal factors that could lead to pregnancy loss. Factors in the baby which may actually lead to pregnancy loss are things like, if baby has some infections, it's possible for some babies to have some infections and some viral infections. We call them the torches infections, toxoplasmosis, rubella, hepatitis, herpes, and if the baby is exposed to any of this, it will lead to pregnancy loss. If the baby is premature, if the baby is, if baby has congenital abnormalities, baby is not forming well. And that's the commonest cause of pregnancy loss in the first 3 months of pregnancy, malformations in the baby as baby is being formed. So congenital malformations could actually also lead to pregnancy loss. Placental unit factors, when you have multiple pregnancies, that's also a fetal factor. That's also another risk of pregnancy loss. It's not uncommon to see a woman diagnosed with twin pregnancy, and then later on, he will say that it's only one baby, but that is in the womb later on in the pregnancy. So multiple pregnancies are associated with a lot of challenges, which also lead to pregnancy loss. Separation of the placenta prematurely. The placenta is supposed to be in place until after the delivery of the baby. So separation of the placenta prematurely, that will also lead to a pregnancy loss. Cord accidents, the umbilical cord, when it is compressed or when it is twisted on itself, and other issues affecting the cord will also lead to a pregnancy loss. So these are just some factors which will actually lead to pregnancy loss in a woman. Thank you.
Oh, that's quite a lot. I mean, you've listed all manner of different causes. And I must say, my head is reeling with the number of things that can go wrong within a pregnancy and cause pregnancy loss. So, but with all of that, are there any factors, any risk factors that are external? Is there anything a woman can do to prevent herself from losing the baby?
Well, I understand the alarm, like you said. I mean, it's going to be scary to hear that, and I don't want to alarm our viewers. So, like you said, it's only 10 to 20% of pregnancies that miscarry. So let's know that they are in the minority. But like you said in the introduction, loss of a pregnancy is a very harrowing thing. So, I mean, medicine has been quite extensive to try and look for what could be causing it so that we could prevent it. And that's why we have that long list of things that could cause it. I think some of the things I said have already included some of the risk factors, like multiple pregnancy, the woman who is using drugs, the woman who has some chronic medical illnesses, and stuff like that. So, but when we are talking about prevention, the first thing is just to have health education. I mean, you must be in a good state of health as a woman to carry a pregnancy. And if there are some things that are not in place before your body, and even socially too, you must be ready to carry a pregnancy safely. So let's assume a woman has some pre-existing medical conditions like diabetes or hypertension, or she knows she's resource negative. It's very important that that woman has what we call preconception care, where even before she gets pregnant, she sees a specialist who can, put her in the right state of, right physical state to be able to carry a pregnancy. The diabetes has to be well controlled. The blood pressure has to be well controlled. If it's a kidney disease or, whatever, that has to be well controlled. If she's abusing drugs, for instance, that also has to be treated, and has to undergo some rehabilitation before she gets pregnant. After pregnancy has been achieved, then very good antenatal care is also very important, because antenatal care is where we actually monitor the pregnancy, because anything can go wrong during the pregnancy, even in a woman who is healthy. And some things actually develop during the pregnancy, like the hypertensive diseases in pregnancy. Many of them develop during pregnancy. It's not due to stress, like we always like to say. Sometimes there are some factors in the placenta that actually cause things like preeclampsia. So that means pregnancy has to be monitored so that if any of these things come up, it can be detected. Sometimes women may not even know she has some conditions. So during pregnancy, when we check her, we check for syphilis, we check for hepatitis, we check for HIV. In the initial phase of pregnancy, we do a scan to see are there any fibroids there, are there any position where it could actually affect the pregnancy and lead to pregnancy loss, are there any uterine abnormalities, So that is something that we see, we do in antenatal care. Then we also monitor the baby's growth, because baby could be growing well initially, then after a while, the growth could become stuttered. And with that, we also need to now check and see what is causing that. So antenatal care is very important. At delivery level, because, well, it's also a place, because a woman could actually the baby could be born not alive. And that could also be due to factors that happen even at delivery. Pregnancy might have been okay at the labor stage, that things could actually go wrong. So it's very important that a woman has a delivery where there's what we call a skilled attendant at delivery, somebody who knows how to manage labor, how to take a delivery properly, because complications could arise in labor, whereby a baby that was very well before labor started would end up losing its life during labor.
Yeah. Now, are there any common myths, culturally? We have a lot of thoughts and ideas about pregnancy loss. Are there any common ones that we should, people need to be disabused of, so that maybe any harmful practices that we do culturally that could affect the baby and lead to pregnancy loss?
Well, historically, there used to be a lot of myths concerning pregnancy loss, but thankfully, I think all those things are becoming, I think we are getting more educated and more informed now, like before when things would be turned to some evil spirits or some things happening in the family, as in somebody is cursing somebody and, things like that, like the issues with albinos and stuff like that. But and then sickle cell disease, where it was always, kind of women were kind of stigmatized with that because sometimes they ended up not being able to carry babies. So, but a lot of those myths are being, I think, in my practice, I rarely see them nowadays. So that's why it's even hard for me to come up with them, as even in the public facilities. So I think thankfully we are overcoming those issues of myths concerning pregnancy loss, and people are more open to having medical evaluation, seeing why it happened, rather than thinking it is something mystical that has happened.
No, I think that's excellent, and that shows a lot of progress, because I believe a lot of these issues need to be ironed out. But are we having enough women coming for antenatal care? I think for me, that's a big one.
I'll say yes. I'll say yes, that we have a lot of women coming in for antenatal care. But the issues concerning their coming in for antenatal care is, there are two that come to mind very quickly. One is that where are you having the antenatal care? Are you actually having it in a proper facility with people who know how to manage pregnancy well? Because the woman is pregnant, she just walks into what she sees a clinic. And, and some people actually go to some people who are not actually trained. Some people go to nurses who may not have training in midwifery or antenatal care. So the quality of antenatal care is one of the challenges that we actually see. Some actually even go to some proper hospitals, but even some of those places, some things are not detected early, because it's one of the challenges we see with a lot of our mortality reviews at the Island Maternity where I work, whereby the quality of antenatal care, hasn't been very good, and the woman is referred late, where things are not detected early and the woman is referred late, and that leads to problems. So some people are also handling some things they shouldn't handle, because it may be a good facility, but maybe beyond their capacity, so they need to refer early. And then the second thing is timing of starting antenatal care. A lot of women still tend to start antenatal care about 4 or 5 months into pregnancy, which is about 20 weeks. And at that time, sometimes it may be a bit too, there might be some conditions which may affect the pregnancy, which if detected earlier may have helped to prevent a pregnancy loss. So it's best that a woman comes up for, at least sees a specialist or somebody who is trained in a good facility as soon as she gets pregnant, because there are some things that need to be checked within the first 3 months of pregnancy. So it's not something we wait until later in the pregnancy when we say the pregnancy is well established. So challenges are quality, depending on where they go, and the timing of initiating them.
Well, I think certainly the message we can get out there is come soon as you discover you're pregnant. I think that's key. And then for those who are out there, if they have any challenges, they need to make sure they're referred. Thank you, Dr. Dosekun, for coming on the program. It's important that you are here to give the other half, shall I say, of the issue, which is a neonatal loss, sudden infant, death of the infant. So can you tell us why, because we've talked about the death of the baby before the baby is born, what are the reasons why we lose our babies immediately after birth and as an infant? Can you just give us an idea of why it happens, and also perhaps what we can do to prevent it?
The problem is that the baby doctors and the O&G doctors, stroke experienced GPs, midwives, have to work closer together, so that when there is an identified case that may have a problem with the baby doctors are already involved, or the baby is moved into a hospital where there are baby doctors who can intervene immediately after delivery. Do you know that if a baby doesn't cry and is not helped with a very simple medical device, that baby can have brain damage. So the commonest causes in the first week of life of a baby in birth asphyxia. That's the baby didn't cry at birth, didn't get in air for the brain, and the baby dies, or if the baby lives, the baby will be disabled. The next one is prematurity. And we've observed that there appears to be more premature babies being born now. Another cause of death is infection. And this is quite a big problem, because the baby can decompensate, can just get very ill, can have a fever, and within 24 hours, that baby is moribund. We also now have problems in our environment with jaundice, which should not be a big problem because it is so easy to treat. But the detection of dangerous jaundice is a problem. Doctors and nurses and midwives must know that they should refer. So they don't start running around at that point in time. We should form a network, and there should be a number to call, and then they refer in time, so that before the baby's body systems are damaged, that baby can have some good treatment. These little steps will help in saving the babies in Lagos State when they fall ill or when they are born with problems. So it's a systems approach that would reduce the number of deaths we have of our newborn babies.
That is actually so important. Now, Dr. Oyeniyi, can you tell us how your association helps to deal with some of the issues that have been highlighted by both Dr. Omololu and by Dr. Dosekun?
All right, thank you very much for the question. Association for Reproductive and Family Health was jointly funded by Professor Emeritus Olada Koladipo and Mama Ebundelana in 1989. That's about 35 years ago. And since that time, the organization has been involved in the training of over 50,000 healthcare workers in the areas of provision of quality maternal and child health services across Nigeria. And apart from that, the organization has implemented more than 120 projects across Nigeria and also in the sub-region. And most part of the projects are actually based on maternal and child health services across the country. In particular, we've implemented projects funded by different donors on provision of focused antenatal care, group antenatal care. We've also trained healthcare workers. We've also implemented projects on training of healthcare workers on basic emergency obstetric and neonatal care, which speaks to increasing the knowledge and upskilling the skills of skilled birth attendants to prevent neonatal loss, and also speaking to taking care of pregnant women in the course of their pregnancy. And we've also implemented projects on family planning services, which speaks to what Dr. Omololu alluded to in his submission, that a woman needs to be in very good health and general well-being before going into pregnancy. And family planning will actually help to space the interval between one child and the other, so that a woman can regain her full health before going to another pregnancy. We've also implemented projects on immunization, which is about prevention of vaccine preventable diseases and among young children, among neonatal infants. And also, we have been deeply involved in community engagement, involvement, and participation in the last 35 years. And I'm happy when Dr. Efunbo mentioned that there should be a lot of effort concentrated at the community level as well as the PAC level. At the community level, we've implemented projects on social and behavioral change communication, which helps to dispel the different myths and misconceptions, including misinformation, disinformation about pregnancy and neonatal loss among community members. And of course, we always work with gatekeepers such as traditional rulers and religious leaders and world development committee members in any community where we've implemented a project on maternal and child health services. We also work very closely with community resource persons that are called COPs, as well as community health influencers that are referred to as chiefs. This set of community health workers actually help us to create demand or generate demand for maternal and child health services by conducting house-to-house outreaches, by actually passing on the messages to members of the household, including the grandmothers, the grandfathers, and relatives, and women themselves about the reason for pregnant women to attend antenatal care and ensure that she gives birth with skilled birth attendants. And we've also we have also been working very closely with government in terms of policy formulation and implementation at both national and subnational levels, particularly those ones that relate to maternal and child health services.
Yes, thank you very much. I think, unfortunately, time is fast spent. So we'd like to just go back to Dr. Omololu. Dr. Omololu, in view of all the things that you've heard here now, what more would you like to see in terms of, do you have any last words for our listeners?
Well, I think a lot has been said, and the take-homes are on several levels. One is for the listeners and our patients, our women, to make sure that they ensure that they are just in general good health and just be very conscious of their health, like DoctorsOnAir tries to do on various topics. And as soon as you get pregnant, make sure you see a very good doctor and a very good hospital where you can have your pregnancy monitored and your delivery. And then also after delivery, you have to also make sure you continue with infant monitoring, do your immunization, and be involved in all the projects that the AFRH and other things that the pediatricians advise. So I think that's keeping it simple, really.
Thank you so much. And Dr. Dosekun, any last words for our listeners?
Thank you very much for allowing me to talk within a team of different disciplines, but we must do more of that in Lagos. We must all talk together, work together for the betterment of our women and our babies. Thank you.
Okay, I just wanted to, because I know you have a very specialized units for neonatal care. Can you give, and for those, because we know a lot of physicians listen to this program, can you just give details of a number, how they can reach out to your neonatal units if they find they have a baby in distress? Can you share with us the number, please?
Yes, the number is 080-273-38723.
Can you repeat that, please?
080-273-38723.
Thank you. Thank you very much, all of you, for coming on the program. Thank you for watching. Please like, share, and subscribe for new video updates.